You know that tingling sensation when your foot falls asleep? That's your spinothalamic tract trying to tell you something. Today, we're diving deep into one of the most crucial topics for NEET PG, the spinothalamic tracts. By the end of this episode, you'll understand their structure, function, and most importantly, how to ace those tricky MCQs.
And it's such a fascinating system, you know. The spinothalamic tract is actually one of the most important sensory pathways in our entire nervous system.
Before we dive in, could you give us a quick overview of what exactly we're dealing with here?
Well, the spinothalamic tract is part of what we call the anterolateral system. It's basically a highway that carries sensory information from your skin all the way up to your brain.
And what kind of information are we talking about specifically?
So there are actually four main components. You've got the anterior spinothalamic tract, which handles crude touch and pressure, and the lateral spinothalamic tract for pain and temperature.
Wait, there are four? What are the other two?
Yeah, then you've got the spino-reticular tract, which helps increase our alertness to pain, and the spinotectal tract, which helps us orient our eyes and head towards stimuli.
That's really interesting. So it's not just about sensing pain, it's about responding to it too.
Exactly. And this is where NEET PG questions often try to trick you. They might ask about the functions of these different components separately.
Let's break this down systematically. Can you walk us through how this system actually works?
Sure. It starts with what we call first-order neurons. These are pseudo-unipolar neurons located in the dorsal root ganglion.
Pseudo-unipolar. That's a term that might show up in MCQs, right?
Absolutely. And here's a key point. These neurons can be divided into different types based on what they sense. You've got mechanonociceptors for pressure, thermal nociceptors for temperature, and chemically sensitive nociceptors.
And these all feed into the same system?
Yes, but they use different fibers. The mechanoreceptors use fast-conducting A-delta fibers, while thermal and chemical nociceptors use slower C fibers.
That's fascinating. What happens next in the pathway?
Well, these first-order neurons synapse with second-order neurons in the posterior gray horn of the spinal cord. And here's where something really important happens.
Let me guess. The crossover?
Exactly. The second-order neurons immediately decussate or cross over via the ventral commissure at their respective segmental level.
And this is crucial for understanding clinical presentations, right?
Absolutely. Because of this crossing, damage to one side of the spinothalamic tract affects sensation on the opposite side of the body.
That must be a favorite topic for exam questions.
Oh, definitely. They love asking about lesions and their effects. And here's another key point. The arrangement of these fibers is somatotopic.
Somatotopic? Can you explain that?
It means the fibers are arranged based on which part of the body they come from. The lower spinal cord fibers are more dorsal and lateral, while the rostral levels are ventral and medial.
That's really interesting. What about the third-order neurons?
The third-order neurons are in the thalamus, specifically in the ventral posterior lateral nucleus, and they project to the primary somatosensory cortex.
And that's Brodmann areas 3, 1, and 2, right?
Exactly. You're getting good at this. These areas form what we call the postcentral gyrus.
You mentioned earlier about clinical presentations. What are some key things students should know?
Well, if you have a lesion in the brainstem, you'll get loss of pain and temperature sensation on the contralateral side of the body at all levels.
And what if the lesion is in the spinal cord?
Then you'll get loss of sensation at and below the level of the lesion on the contralateral side.
That's a really important distinction.
And here's something fascinating. This system also connects to the reticular formation, which is why we become more alert when we feel pain.
That's such a cool evolutionary adaptation.
It really is. And it's all represented in the sensory homunculus, where different body parts get different amounts of cortical real estate based on their sensitivity.
Like how our lips and hands have larger areas than our back?
Exactly. The face, hands, and arms are represented on the lateral surface, while the legs and genitalia are on the medial surface.
Let's talk about exam strategy. What are some common types of questions students might encounter?
They often ask about the different components and their functions, like distinguishing between anterior and lateral spinothalamic tracts.
And what's the key difference there?
The anterior tract handles crude touch and pressure, while the lateral tract deals with pain and temperature.
Got it. What about clinical scenarios?
They love presenting cases with specific sensory deficits and asking students to localize the lesion.
And the key is understanding the crossing of the fibers, right?
Exactly. Remember, the fibers cross immediately upon entering the spinal cord, so lesions affect the opposite side of the body.
What about the different types of nerve fibers?
Yes, that's another high-yield area. A delta fibers are fast and myelinated, while C fibers are slower and unmyelinated.
And they carry different types of sensations?
Right. A delta fibers mainly carry sharp, localized pain, while C fibers carry dull, burning pain and temperature sensation.
This is really comprehensive. Any final tips for our listeners?
Focus on understanding the pathway as a whole system. Don't just memorize individual facts.
And make sure to practice with lots of clinical scenarios?
Absolutely. The more you can connect the anatomy to clinical presentations, the better you'll do on the exam.
This has been incredibly helpful. Any last words of wisdom?
Remember that understanding these pathways isn't just about passing exams, it's fundamental to clinical practice.
That's such an important point.
And don't forget to review the associated structures, the thalamic nuclei, reticular formation, and somatosensory cortex.
It all connects together, doesn't it?
That's the beauty of neuroanatomy. Everything is connected, literally and figuratively.
Well, that brings us to the end of today's episode.